These problems jumble and come out because of saying the same nomenclature for different lesions, or the same lesion has different names. And for example, the term hemangioma combined with descriptive modifiers such as strawberry, cavernous, lymph is used to describe tumors and birthmarks and vascular malformation. The problem started here. Vascular anomalies are a distinct featured diagnosis, whether they are vascular anomalies that are congenital or they are acquired, whether they regress or they progress over time, they are a distinct problem, a distinct diagnosis. These faulty designations lead to improper communication between the doctors and to improper diagnosis. And when I'm talking about something, you are understanding another thing. And this makes confusion in the treatments of patients and also misguided interdisciplinary communication. So take care when we are talking about our introduction about the vascular anomalies. We started to take a long time talking about the nomenclature because there is much confusion in this area. And this happened since Virchow started in 19th century. He had many diagnoses and he started to say the term angioma, angioma simplex, angioma racemosum, and angioma cavernosum. And he means something that's not now known as this name. It's called infantile hemangioma. But the same infantile hemangioma, if it's on the skin, he called it angioma simplex. And if it's in deep, he called it angioma cavernosum. And also, what's so-called now AV malformation, he calls it as angioma racemosum. And then Wegener comes and says it's cystic hygroma, it's lymphangioma, while now the right nomenclature is lymphatic malformation. Either they are macro or microcystic. This is about the nomenclature. Okay. Then we start about something called the classification of the vascular anomalies. The main classification of the vascular anomalies was created by Mulliken in 1982, and then is later developed this classification by the International Society of Study of Vascular Anomalies, ISSVA, and that was in 1996. So in 1982, Mulliken started the classification, and actually there was a confusion in the nomenclature and wrong terms. So that's normal that the classification is not right in all its aspects. And then it was improved by the International Society of Study of Vascular Anomalies in 1996. And then this system divided these anomalies into vascular tumors, as we said in the introduction, vascular tumors and vascular malformations. So we are talking in this now about two categories, vascular tumors and vascular malformation. And as we said, it's based on the physical, the biological, the clinical behavior. What's meant by physical and biological? It's the cellular behavior. And what's meant by the clinical behavior? It is the progression, regression, and clinical features. Actually, the biological behavior is the base of the clinical behavior. And then the classification system was expanded because many other complicated cases appeared, and they cannot be put or categorized in this simple classification done in 1996 by the ISSVA, International Society of Study of Vascular Anomalies. What happened? More difficult cases arose, and we should say that the vascular tumors are categorized as three categories: benign, locally aggressive, and malignant. This is the vascular tumors. And the vascular malformation are categorized according to the type of vessel. If only one type of vessel, it's simple. And if more than one type of vessel or combined, it is more complex. And if the vascular anomaly, not the vascular tumor, the vascular malformation is combined with another feature that's characteristic, like gigantism, local gigantism of an organ or something like that, limb overgrowth, they are categorized separately. So to sum up, the classification started 1982 by Mulliken and his colleague Glowacki. And then it was improved by the ISSVA in 1996, and it has main two categories. The first category is the vascular tumor, the second category is the vascular malformation, and the main issue of this categorization is the biological and physical besides the clinical behavior. After that, many other conditions that are complicated happened, and they cannot be categorized inside this simple classification. So what happened is another complex classification, also named two categories, the vascular tumor and the vascular malformation. But the tumor has three categories: benign, locally aggressive, and malignant or aggressive. And the malformation, not the tumor, the malformation according to the type of vessel, either single type or combined. And if another feature like local gigantism or limb overgrowth, it is classified separately.